This is Dr. Christopher Sundy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. I'm going to discuss Lamictal and whether or not it makes ketamine therapy less effective. I frequently get asked by patients whether or not they need to stop their Lamictal. A lot of patients have done their due diligence and they see things written all over the place saying that Lamictal prevents ketamine from working and that they have to stop it. And there's a lot of centers that will tell patients to stop their Lamictal or decrease it significantly prior to their treatment. And Lamictal is an excellent treatment for bipolar disorder and bipolar mood disorders. And by changing individuals' Lamictal, you may destabilize them prior to even starting your ketamine therapy. And so the question is, do you even need to deal with and change the Lamictal prior to those ketamine therapies? And our experience is that we get excellent results with patients on Lamictal, and the use of ketamine doesn't seem to interact with Lamictal or make the treatment less effective. So Lamictal is an anti-epileptic drug that's been repurposed for mood stabilization. And what it does is several things in the brain. It inhibits voltage-sensitive sodium channels in the neurons and stabilizes the presynaptic neuronal membranes. It inhibits glutamate release. And it also increases certain neurotransmitters like serotonin and dopamine in the extracellular areas, and it inhibits the uptake of serotonin and dopamine so that their levels go up where they need to be. And also, there is an increase of brain-derived neurotrophic factor that occurs because Lamictal downregulates the arachidonic acid signaling pathway, which allows for AMPA expression to increase. And that is a receptor, a postsynaptic receptor frequently that gets activated. When it does, it causes a cascade of events to increase the production of brain-derived neurotrophic factor. And that's seen here in this diagram. And basically, it's felt that Lamictal may be synergistic with ketamine. So effectively, we have a glutamate neuron here and a presynaptic neuron and a postsynaptic neuron, the one that receives the signal. And there's a GABA interneuron that basically, when it is turned on and releasing GABA, it interacts with this GABA receptor here, and it shuts down the presynaptic neuron from releasing any large amounts of glutamate. There's always a low constant drip of glutamate that interacts with primarily AMPA receptors and causes some depolarization here. And what happens is that when you get ketamine, basically you turn this GABAergic interneuron off, and that allows for a burst of glutamate to occur, which interacts with AMPA receptors. And of course, ketamine inhibits the NMDA receptors. And by doing this, this allows for basically currents of sodium to enter into the postsynaptic neuron, and brain-derived neurotrophic factor gets released and interacts with this particular tyrosine kinase beta receptor, and then we ultimately end up with activation of mTOR, which causes the production of specific proteins, increasing synaptic strength, connectivity, and density, and of course it increases brain-derived neurotrophic factor levels as well. It turns out Lamictal also, or lamotrigine, interacts with AMPA receptors and improves this production of brain-derived neurotrophic factor, which ultimately leads to more synapses and more neuroplasticity. And so that's kind of the basics of how Lamictal and ketamine kind of do very similar things in the synapses. So we know that ketamine therapy works very well in bipolar depression, and a number of trials have demonstrated this. We have one here by Zhang and his colleagues in 2020 demonstrating that ketamine causes a remission in over 60% of patients with bipolar disorder. And we know from McIntyre's group in 2020 that repeated doses of ketamine have been used as a method of maintaining the antidepressant effects and also demonstrate a 50% remission rate in unipolar and bipolar depression. And they used actually 200 treatment-resistant patients, some of which had bipolar depression, demonstrating significant and rapid improvement in depression and suicidality as soon as the fourth infusion. Now, ketamine therapy also has a rapid impact on bipolar symptoms such as agitation, irritability, anxiety, and suicidal ideation. These are really common in depression, especially with mixed features. And this was, again, the study by McIntyre's group in 2020. We know that ketamine works through the glutamate system. We kind of discussed its functioning in the prior diagram, but effectively we get a glutamate surge in the prefrontal cortex that occurs when the GABA interneuron is turned off. And this is basically an on switch for a glutamate release into the synapse, and that causes eventually the turning on of the postsynaptic neuron's metabolic machinery to produce brain-derived neurotrophic factor, which is key in protein production ultimately, that allows for synapse formation and dendrite formation. So there's been a number of studies about Lamictal and its interactions with ketamine. And a general review of ketamine therapy and the Lamictal, lamotrigine, suggests that lamotrigine can actually decrease ketamine craving. And that basically there are a number of rodent studies demonstrating that there's actually a synergistic effect of ketamine with lamotrigine. That means they make each other work better. And that also lamotrigine increases ketamine effectiveness, and that lamotrigine can potentiate the effect of ketamine in terms of neuroplasticity, synapse strength, and augment the antidepressant effects, as well as decreasing lipid damage in the hippocampus. And this was evaluated by a study by Roos and his colleagues in 2017. And basically, they were looking at treatment of ketamine with different antidepressant classes and looking at things like inflammation and oxidative stress. Also, it appears that lamotrigine may increase the tolerability of ketamine, and studies on healthy participants suggest that lamotrigine can increase the tolerability of ketamine therapy. There are a number of case series and case reports suggesting that ketamine and lamotrigine augment the antidepressant effect when used together. And basically, there's a series of patients discussed here with Chan and his group in 2018. And they kind of frame ketamine as the future clozapine for depression. And you may be aware that clozapine is FDA approved for suicidality. Also, it's been noted that lamotrigine may decrease dissociation. And this may be one of the issues that a lot of people have and clinics have, is that there's less of a dissociative effect when you take lamotrigine, apparently. We haven't noted patients complaining of lack of dissociation at higher doses of ketamine. However, this is something that's mentioned in several studies. And so there definitely are a lot of studies that look at dissociation and the ultimate outcomes of ketamine therapies. But from a prior video, we discussed that there isn't really an association of dissociation and improved outcomes, meaning you don't have to dissociate to make ketamine work better. But for some people, the journey certainly has its impact on them. So people who are on lamotrigine and get ketamine, they still have the journey, but it may be a slightly different journey in terms of how they feel it. But effectively, based on this study here with Anand, they looked at the attenuation of neuropsychiatric effects with ketamine and lamotrigine. And they took 16 healthy subjects. They gave them 300 milligrams of lamotrigine prior to the therapy with ketamine, noting lower dissociation scores, but they noted also that there was better learning capacity, and there was also elevated mood, and also an elevation of the effects of ketamine with this treatment. So there weren't negative outcomes. It was just basically some attenuation on the dissociation. And also, lamotrigine does not alter functional connectivity that's induced by ketamine, which is, again, a key thing, is that basically there's broken neural circuitry in depression due to the disconnection and lack of neuroplasticity. And effectively, we want to keep that functional connectivity going. And there was a set of studies on 20 healthy males where they used lamotrigine and did not find any alterations in the functional connectivity pattern that was induced by ketamine. And this suggested no interaction. This was a study by Jules and his colleagues in 2015. Also, lamotrigine given prior to ketamine did not actually decrease the effect of ketamine in terms of treatment of depression. And in this particular study with Matthews and his colleagues in 2014, in a randomized controlled trial with 26 treatment-resistant patients who are medication-free, a single dose of lamotrigine and a single dose of ketamine infusion basically found no differences in dissociation scores, and also the depression scores did not differ between the placebo group and the treated groups. And the ketamine infusions were very well tolerated. Effectively, there was a neutral effect with lamotrigine and ketamine. So, in summary, lamotrigine certainly may decrease the dissociative symptoms of ketamine infusions. Whether that's positive or negative remains to be seen, but effectively, a lot of patients still get great effect with ketamine infusions while they're on lamotrigine. And it's clear that bipolar disorder may require lamotrigine as a treatment, and it's important not to stop a medication that's designed specifically for bipolar disorder or decrease it, because that could destabilize the patient. And there aren't any large control studies of bipolar patients with multiple ketamine infusions combined with lamotrigine. However, there's plenty of smaller studies and also case series, and it appears from all of them lamotrigine and ketamine most likely have more of a neutral interaction, that there's no issues whatsoever. And that's clinically what we see as well, is that patients who have bipolar disorder, they generally just respond better to ketamine infusions, whether or not they are taking lamotrigine.